Good morning everyone. Today we will discuss about a new topic, that is scoliosis. So let's begin. So in the scoliosis we are going to discuss about its definition, etiopathogenesis, pathology, clinical feature, investigation and diagnosis and the treatment. Yes, we are discussing about the scoliosis, and scoliosing is the bending of spine right or left. So that is your scoliosis definition. So what is here? Leaning tree concept, emblem of orthopedics, means when a tree is weakened, it bends toward right or left or forward or backward. So what we are gonna do, we have to support that tree by some stake or some protection around, or protect from the cage, like that. So our spine resembles as same as tree. If tree is weakened, it will bend. If our spine is weakened, it will be bent forward or backward or right or left. So that is your leaning tree concept. Human posture. Posture alignment of the body and the segment with respect to environment as well as with each other. What is posture? Posture is the alignment of the body segments. Okay, and the human posture is erect, upright and bipedal. Bipedal means we walk on our toes, that is your bipedal nature, and animals are walking on quadrupedal, on four toes. And the ideal posture is a position of which minimum stress is applied over the body structure, which produce maximum efficiency and the minimal effort. So what you have to produce maximum efficiency with the minimum effort. Faulty posture is maximum effort but the minimum efficiency, that is your faulty posture. So that's the basic difference between the ideal posture and the faulty posture. So good posture is, here is the diagram, you can see the balanced upright posture. Your line of gravity falls through the vertex and through the earlobes. This is the side view or the sagittal view. The bodies of the cervical vertebra, tip of the shoulder, anterior to the thoracic vertebra. So here is your thoracic vertebra, lines passes anterior to the thoracic vertebra through the body of lumbar vertebra and the slightly posterior to the hip joint axis, slightly anterior to the knee joint axis. Here you can see that the knee joint, and slightly anterior to the knee joint axis and just anterior to the lateral malleolus. Here you can see the malleolus, the line passes just anterior to the lateral malleolus. And the posture: cervical lordosis, thoracic kyphosis, lumbar lordosis and the sacral kyphosis. As we know, our cervical vertebra has lordosis, thoracic has kyphosis and the lumbar has lordosis. So here you can see in the diagram kyphosis, lordosis and the kyphosis. Kyphotic spine in infancy. Kyphosis is the primary curvature. When a baby born, it born with the kyphotic structure. By the age or by the adolescence, the body adapt with the gravity or the weight bearing. So our normal curves are developed by the age, by the progression of age. So curve progression, newborn, the newborn baby have flexed posture, that is your kyphotic posture, and the cervical lordosis. Cervical lordosis developed by the 3 to 4 months and the lumbar lordosis developed by 8 to 12 months, and the normal curves adult in the adolescence. Disappear of the secondary curves with the age. So postural reflex, that is input unit, that is sensory reflex, processor, that is your central nervous system, and the output is your motor. First we sense, or we sensory organ is activated, then it processes through the central nervous system, then we act on the mechanism. Suppose we have to pick up any mobile phone or any object in the table, on the table. So what we have to do, first we have to sense like that. Here is a mobile, so we have to pick up that mobile. So there is sensory touch of the mobile, then we process the sensory on the thoughts and the output. Motor means we act, like we pick up the mobile from the table, that is your motor action. Motor means any working, that is your motor action. The correlation of this, that is your spinal deformity, that causes the spinal deformity. And the curves of spine we had already discussed. There is a cervical lordosis, thoracic kyphosis, and the lumbar lordosis, and the sacral kyphosis. So here are the some abnormal deformities or abnormal possibilities of the spine. So first one is scoliosis. Scoliosis is a lateral curvature of spine, usually with the some rotational element. If the scoliosis is there, there is a lateral curvature with some rotational element is present. Kyphosis means the sagittal plane curvature of the spine with apex of convexity direct posteriorly flexion. So that's your kyphosis. Lordosis means the sagittal plane curvature of the spine with the apex of convexity directly anteriorly extension. So in the lordosis and the kyphosis, the basic difference is in the kyphosis there is a hyperflexion and the lordosis there is a hyperextension. So don't get confused. Scoliosis means twisted. It's a Greek word. In the Greek word, scoliosis means twisted. Definition: abnormal lateral curvature of the spine in excess of 10 degrees, usually with some rotational element. There is a some rotational element is present, and there is a abnormal lateral curvature is also present. Exception: a very slightly physiological curve in the thoracic spine, which is convex toward the right side due to the presence of aorta and the right hand dominance. So these are the exceptional case. The biomechanical explanation of the scoliosis. What are the biomechanical factors behind the scoliosis? The spine remains erect in a normal conditions because of the maintenance of a delicate balance between the static means steady posture, that is passive or contractile structures such as bone, ligament, and the capsule, that is your static structures, and the dynamic, that is active contractile structures like a muscle and a tendon. So your muscle and tendon are the dynamic structure, and your bone and the ligament and the capsules are static structure which cannot move, which gives supports your body. A mechanical factor such as LOG, COG, and base of support. So line of gravity, center of gravity, and base of support are the mechanical factors affecting the scoliosis. Scoliosis can result from any disturbance in this delicate balance. So your static, dynamic, and mechanical, all the three act together. If any of these disturbance in any factor, that is mechanical, dynamic, or static, that gives you scoliosis or some amount of abnormalities to your spine. So here you can see there is a diagrammatic representation or the ray diagram. There is a pelvis, and this is your spine. This is your muscles, and this arrow right or left, this is your muscles. If there is an imbalance between your muscles and the pelvis and the spine, there is an abnormal curvature. If there is a shortening or any tightness in the muscle group, that causes your lateral curvature of spine. There is a pathomechanics behind this. The primary curvature, lateral curvature of the part of spine which is main pathology. Secondary or the compensatory curve, spine above or the below primary curve undergoes compensatory curvature in opposite direction. So from behind, from the posterior, you can see there is a single curve that is C-shaped, imbalance uncompensated, double curve that is S-shaped, balance compensated. So there is a two types of scoliosis, that is C-shaped and S-shaped. So C-shaped curve, that is right side, and S-shaped curve, that is your left side. Regional, there is a regional variations also present. Scoliosis of cervical spine is sometimes called torticollis. Torticollis usually present in the cervical spine, that is your neck. In thoracic spine, vertebral deviation and the rotation causes prominence of the rib cage, forming a rib hump responsible for ugly rib cage deformity, thoracic lordosis, and the respiratory compromise. So, if there is a scoliosis in the cervical spine, it is called as torticollis. If there is a scoliosis in the thoracic spine, it causes the ugly deformity, and in the lumbar spine, scoliosis is mostly the compensation of the lower limb abnormality, such as the limb shortening and the deformity. If there is a limb shortening or any deformity to your lower limb or the below the pelvis, that cause the lumbar spine scoliosis. Okay. So there is a two types of scoliosis. First is non-structural and second is structural. Non-structural means transient and structural means permanent. The permanent means it can be corrected by surgical method. Okay. And the transient, that is your postural, compensatory and sciatic. Posture, by any posture deformity, the scoliosis is present. Any compensatory, if there is a muscle shortening or any compensation by the body, that is your compensatory scoliosis. And sciatic, if your sciatic nerve or the nerve damage cause the scoliosis. Idiopathic means no known cause. There is a no known cause, that is your 90% scoliosis. And the congenital means by birth, and the paralytic and others. These are the classification of the scoliosis as per the etiology. Non-structural scoliosis, also called as transient or the functional curve. These are the mobile curves. By the definition, no structural abnormalities are there. Vertebrae are not rotated on their long axis. Thus, the uniplanar abnormality curves can be corrected if the primary curve of the cause of the curve is corrected. Cause can be postural defect, peripheral nerve root irritation, limb length discrepancy are there. Postural scoliosis, example habitual poor posture, compensated scoliosis. There is a limb length discrepancy, there is a shortening of the limb, and the sciatic scoliosis by the PIVD. PIVD means prolapse intervertebral disc. If your disc is prolapsed, it compresses the nerve root, and the nerve root can cause the sciatic scoliosis. Okay, let's summarize our presentation. So very important, all the non-structural scoliosis may get organized into structural due to secondary soft tissue structure in the muscles and the ligament on the concave side of the curve. That is the important factor. And the scoliosis is a sideways curvature of the spine or the lateral curvature of the spine, as we know. Scoliosis is a sideways curvature of the spine that occurs most often during the growth spurt just before puberty. So it develops just before the puberty, while scoliosis can be caused by the conditions such as the cerebral palsy and the muscular dystrophy. The causes of most scoliosis is unknown. So these are the basic of this scoliosis. So here are some practice question. Please do at your home.